The modified Bass technique of toothbrushing is used by patients that have good manual dexterity and limited gum recession. The brush is placed at a 45-degree angle onto the front surface of the teeth, with the bristles projecting into the pocket surrounding the tooth. A small circular motion is made with the bristles into the pocket. Then, the bristles are swept from the gum line to the biting surface of the tooth, brushing over the entire front surface. This technique is then completed on the inside surfaces of the teeth. The toothbrush is once again placed into the pocket at a 45-degree angle, completing small circles, then brushed from the gum line to the biting surface of the tooth.
Let's look at our animation model. We'll call her Sue. As we look inside to see Sue's muscles, bone, and teeth, we see how a healthy bite and jaw joint work together. As the mouth opens, notice how the jaw bone rotates in the joint but stays braced against the skull with the cartilage disc cushioning between the two bones. As Sue closes, notice how the jaw rotates back, staying braced and cushioned at all time until all teeth come into contact at the same time. At the end of the chewing stroke or opening and closing cycle, all the teeth have come together into the bite and the jawbone and disc are braced against the skull. What would it look like if Sue had a bite problem? Her jawbone starts off braced in the joint, but as she closes, her teeth come into contact prematurely in the back so that in order for the rest of her teeth to come together, her jaw has to come out of its socket, down and backward to avoid the early contact, which can be damaging and painful to the teeth. This is why we say that Sue has an unstable joint and is not braced throughout the opening and closing cycle. During the daytime, Sue's brain programs her muscles to make sure that the bite always comes together evenly, avoiding the early tooth contact in the back of the mouth by keeping the jawbone out of the joint socket. During sleep, the brain wants to rest and not worry about constantly programming the muscles, so instead it tells the muscles to either clench or grind the teeth so that they stay locked together. The jaw stays out of the socket all night and the muscles of the head and neck are working constantly during sleep. Since these muscles get overworked every night, they become fatigued, leading to spasms and inflammation. The result of the chewing system being constantly overstressed is breakdown of the teeth, gums, bone, and joint, and finally pain such as headaches and migraines, neck and shoulder pain, or popping and clicking of the jaw joint, among other symptoms. With an orthotic that bioaesthetic dentists call a mago splint, the jaw-bite relationship can be stabilized. Notice how the jaw joint is staying braced in the joint against the cartilage disc when the teeth bite against the mago. Sue has been treated with the mago splint to relax the muscles and let the jaw joint stay in its proper location. This is a diagnostic process that helps the dentist and patient learn what is causing the pain and what could change if the jaw joint stays in place. From this information, a final treatment can be formulated. Treating this problem will result in the bite and jaw joint becoming healthier and the muscles getting well-deserved rest. The result is that Sue will probably feel and sleep much better.
Nine out of 10 adults have some form of tooth decay. Half of American adults have periodontal disease.
This video shows two ways of straightening crooked teeth. On the left, using conventional braces, and on the right, using ClearPath clear aligners. While braces involve tedious procedures of attaching brackets, wires, and elastics to teeth, resulting in an unsightly appearance, ClearPath aligners are removable and transparent so that no one knows you are straightening your teeth. With braces also comes the difficulty in brushing, leading to plaque and calculus buildup, often resulting in bleeding and swollen gums, bad breath, and even receding gum lines. On the other hand, removable ClearPath aligners give the freedom of maintaining the perfect oral hygiene, and their smooth edges and comfortable plastic never hurt your gums, tongue, and cheeks, which cannot be said for rough brackets and poking wires. The poor oral hygiene and lowering of pH due to braces leads to tooth decay and development of white spot lesions on the tooth surface. Unfortunately, both are irreversible conditions. ClearPath aligners generate precise, controlled and predictable movements of teeth and have excellent snug fit that facilitates these forces. Whereas the uncontrolled movements exerted by braces may lead to root resorption, eventually leading to loosening and even exfoliation of teeth. Comparing the two treatment options, one can clearly see that ClearPath aligners offer a more aesthetic, comfortable, and healthier solution compared to braces.
This is the video animation of the FDA-cleared periodontal procedure called LANAP, an acronym for Laser-Assisted New Attachment Procedure. The fiber optic tip is gently placed at the top of the periodontal pocket to begin removal of diseased tissue that lines the pocket. This is where bacteria live and build a neighborhood of its own that destroys healthy gum tissue and bone that holds your teeth in their proper position. There are specific germs and bacteria that cause gum disease. The Periolase laser is designed to target and eliminate selectively only the diseased tissue and germs, dissolving toxins and leaving the healthy tissue unharmed. The laser tip is then removed from the pocket and set aside. In the next step of the procedure, ultrasonic cleaners as small as a laser fiber tip are used to remove the hard deposits we call tartar or calculus from the top of the teeth and roots. These instruments use sound waves to vibrate and break apart the hard mineral calcium deposits, with water flushing away the debris and cooling the instrument tip. Some hand cleaning instruments may be used at this time to remove any remaining hard calcium deposits. Then the laser is used again at the bottom of the pocket to remove any remaining diseased tissue. This pass of the laser also sterilizes the tissue and bone and completely eliminates the bad bacteria, germs, and toxins. It also stimulates the formation of a blood clot, which once formed contains fibers that reattach your tissue to the tooth surface and seal out debris and bacteria like stitches would, and creates the right environment to cause the bone and other soft tissues lost from the disease to grow back.